నమస్కారం. డాక్టర్ బిఆర్ అంబేద్కర్ సార్వత్రిక విశ్వవిద్యాలయం విద్యార్థులకు స్వాగతం. ఈ ప్రసారంలో
Students, welcome to this program. Today's topic for discussion is anxiety disorders. It is one of the units in psychopathology of M.Sc psychology and also UG psychology. Students, as you know, anxiety disorder is one of the most common mental health disorders, and we as people we experience anxiety every day at some point of time. Anxiety is a common thing, but why it becomes a problem? It becomes a problem when the feelings of fear or worry are excessive in nature or prolonged or out of proportion to the situation. So, this causes many health problems, physical health problems, and also it affects the progress of the person, and it also affects the day-to-day function of the person. So, to discuss these issues, we have with us an expert in psychopathology. This is Dr.Usha. She is from Central University, Hyderabad Central University, Department of Health Psychology. We will discuss different aspects of the anxiety disorders. There are different types of disorders. We will discuss 4 types of these anxiety disorders. We will also discuss the symptoms of the disorders and also treatment, how to treat this disorder. We will discuss these issues today. Dr. Usha madam, what do you mean by the anxiety, and what is the definition of this anxiety?
Anxiety is a very common term which we hear every day. It is a general feeling of apprehension of any danger or any situation that is fearful. So, in an anxiety disorder specifically, we can see that there is excessive anxiety rather than a normal general anxiety. Here the anxiety is excessive, and there is also it is accompanied by fear or worry. And in anxiety disorders, across the disorders, we can see that there can be situation like the person may avoid the situation, there may be constant worry or fear, or he or she may also develop some kind of compulsions or rituals. This can be due to, these will help the person to lower the anxiety. So, you would see that there is intense and prolonged feeling of fear, and which causes some kind of distress, and it interferes with the normal daily functioning. And if you look into these anxiety disorders, you can see that if a person has these disorders, it creates a enormous personal, economic and health problem to the individual, and also interrupts the general functioning of the individual.
Dr. Usha, there are different types of anxiety disorders. What are these types of disorders? Can you name a few disorders?
So, to go with the anxiety disorders, if we look into the classification, in the recent classification of DSM-5, they have categorized the anxiety disorders and given a classification. But to be brief, we will be discussing about a few today. And to name a few, we will talk about the generalized anxiety disorders, which is a chronic worry in simple terms. Then we have the panic disorders, where there is overwhelming fear about a situation or about a thing. Then we will be talking about post traumatic stress disorder, which is because of certain traumatic or stressful experience. There is also the obsessive compulsive disorder, wherein there will be intrusive or distressing either compulsions or obsessions. Social anxiety disorders or specific anxiety disorders or specific phobias, where there is fear because of a particular situation or fear in public. And you have these are some of the categories of disorders which we are going to discuss today.
Given the different the anxiety disorders, like the say generalized anxiety disorder and panic disorder and OCD, that is obsessive compulsive disorders. What are the symptoms of this GAD, that is generalized anxiety disorder?
Now, coming to generalized anxiety disorders, this is a situation wherein there is anxiety and worry about different aspects of life. I mean, they may be very minor events or they may be major events. Now, these worries become very chronic and excessive, and sometimes these worries are also unreasonable. So, a chronic worry about an event or an activity, but when there is no threat, no specific threat, is called a generalized anxiety disorder. And coming to the specific symptoms, you can see that there is excessive worry, and this worry is very difficult for the individual to control. And if you can see that we have to be very specific with some of the symptoms, which usually would be some physiological symptoms like restlessness. The person may have fatigue, constant fatigue, difficulty in concentration, irritability, muscle tension, and some sleep disturbances can be observed. The person may also have distress in social and occupational situation, and this is not seen, this need not be because of any medical condition as such. So, this is some of the criteria or symptoms that we can see in generalized anxiety disorders.
So, mostly it is characterized by excessive fear, worry,
Yes.
and also it is persistent, continuous for a long period.
For a long period of time, and there is a constant worry over situations. There will be a constant
Mostly
worry.
they are unreasonable.
Unreasonable worry.
Unreasonable worry. Is there any treatment for this for treating this disorder?
Definitely, this disorder can be treated. Basically, it may be because of certain brain chemical imbalances, like the imbalances in neurotransmitters. So, there can be some medications if necessary, or otherwise the psychotherapy is one of the methods in treatment. Like behavior therapy and cognitive behavior therapy are very much useful in treating generalized anxiety disorder.
And there is another disorder called panic disorders. How to notice this, identify this panic disorder?
Panic disorder is characterized specifically because of frequent panic attacks that are unrelated to specific situation, and these are accompanied again by intense anxiety, and these anxiety there is also a fear that there may be another attack of panic situation again. So, that is panic disorder, and there may be again related to the fear is that the person may develop this attack again.
Okay. So, it also affects the health of the person.
Yes, it has health issues across situation again. It may help interfere in the general functioning of the individual.
Okay. Another category is phobias. What are these phobias, madam? There are different types of phobias. So, what is this phobia?
Now, coming to phobias are persisting and disproportionate fear of a specific object or a specific situation. And then there may be a presence or no presence of the actual danger that the person is thinking. They may not be, the dangerous situation may be there, may not be there, but the person will have persistent and disproportionate fear about a specific object or situation. Now, phobias are again divided into specific phobias and social anxiety disorders. You also have agoraphobia as one of the specific phobias. Coming to specific phobia is fear about presence of a specific object, fear of like fear of flying, fear of heights, fear of animals, or fear of receiving going to a doctor and getting an injection done. So these are certain specific situation because of which the person is feeling the fear, or it may be reasonable or unreasonable, the person has fear. And there is also social phobia, wherein the person has fear in performing in a situation, especially in a public situation or when exposed to unfamiliar people.
Right.
So these are the two different types of phobias.
These are some of the types of this phobias. Here this object and situation are specific.
Yes.
And the people know the reason for the fear or worry.
Yes. Yes.
Yeah, but another disorder there is a specific that reason is not specific. The cause is not specific. The objects are not specific.
Yes.
In the other disorder.
In the other disorder.
Yes. There is another disorder that is OCD, that is obsessive compulsive disorder. Will you explain the symptoms of this OCD?
Yeah, OCD is a term which many of us have heard
popularly
about.
known as
Yes,
OCD.
very popularly known as
OCD.
OCD, which is also called as obsessive compulsive disorder. And this is a typical disorder which has obsessions and compulsions in it, wherein there are intrusive thoughts that some kind of harm will occur to the individual, and because of which the person would perform certain acts or rituals. So there is a belief that something may happen. Because of that belief, there is also an action or a performance. Now this performance is usually to reduce the anxiety. So it is characterized by repetitive thoughts or images or impulses or actions. So that is, and sometimes these actions and these thoughts are so repetitive and so continuous that the person will feel very distressing, and many a times these are so time consuming for the individual. So this is obsessive compulsive disorder.
Is there a difference between obsession and compulsion?
Yes, there is a difference between obsession and compulsion. Obsessions are thoughts, persistent thoughts or ideas or images that the person would imagine, or they may be intrusive or inappropriate also. They may not be real, they may be inappropriate to that particular situation. But compulsions on the other hand are repetitive behaviors. Now these behaviors can be washing hands many times, keeping things in order, checking things one or two times or more than that many times, like whether you have locked the door or whether I have kept the keys in a particular place or not. So keeping things in an orderly manner, continuous washing hands. And sometimes they can also be mental acts, like they need not be an action physically, but a mental act where they keep praying or counting or repeating words. So these become very ritualistic for that person.
So the obsession relates to thoughts and the compulsion relates to actions.
Actions.
Can you give an example for this, madam?
It can, like for an obsession, the person may have a belief that he may get a disease. This is at a thought level, and for which the person would have some compulsions of keeping on cleaning a particular place. So maybe if a woman is having a belief that she may have, or she may be invaded by a disease, the person may be always cleaning up, cleaning up the kitchen, cleaning up the floor, mopping the floor, sweeping the floor, cleaning up the bathroom. So continuously she would be performing these repetitive actions because of a belief that a disease may invade her. So this is an example of OCD.
Is it treatable? Can we treat this disorder, madam?
Yes, OCD can be treatable. This can be treatable by psychotherapy or behavior therapy and cognitive behavior therapy. Sometimes there is also a method in which the obsession is paired with certain relaxation techniques and certain to reduce the anxiety,
Right.
and also cognitive restructuring, wherein the beliefs are the faulty beliefs and faulty
Okay.
thought is actually treated.
And there is another anxiety disorder that is called social anxiety disorder.
Yeah.
What are they? How to diagnose this disorder, madam?
Social anxiety disorder is a disorder that is marked because marked by fear for one or more social or performance situations, wherein the person when has a fear that if he or she is exposed to be in public or perform in public, it may cause a kind of harm or humiliation to the person. So invariably, because of this fear, the person will be continuously feeling the anxiety which is coupled by a lot of fear and distress. So that is social anxiety disorder.
Disorder, okay. And there is another important anxiety disorder that is called post-traumatic stress disorder, PTSD. How to diagnose this disorder?
Post traumatic stress disorder, you can with the name we can understand, is a disorder or an anxiety disorder which develops after a traumatic situation, or if a person has experienced either trauma or a stress
Stress.
at some time or some period in the person's life. So because of this traumatic or stressful experience, the person would be be reminded of the particular event, and having images or thoughts, or maybe re-experiencing the event at an imaginary level,
Okay.
which will cause a kind of fear and anxiety to the person. So there will be persistent symptoms of arousal in the person whenever these thoughts come back to his or her mind. That is the post-traumatic stress disorder.
Is there a treatment for this disorder, ma'am?
Yes, the basic treatment would be enhancing the person's coping skills, because the person should be helped to appraise the situation. So coping with appraisal of the situation is one of the treatments that can be given for post traumatic stress disorder. Along with that, cognitive therapy in combination with coping skills technique is very useful. And also stress inoculation training is one of the methods that is used particularly for post traumatic stress disorder, wherein the person is given an appraisal of that stressful situation, and the person is made aware of how to deal with the situation. And along with that, the person can also be given individual counseling.
Counseling, okay. Can you give an example for clear understanding of this post-traumatic disorder?
One of the examples can be it is a case that we can talk about, is a person who's around 15-year-old who had come to the psychologist for treatment. Now she was having restlessness and sleeplessness and re-experiencing certain thoughts and images. So when she was counseled, it was found that the person went through a very abusive childhood.
Okay.
So that was a traumatic situation for that child who went through a very abusive childhood, and that trauma she was re-experiencing even in the present situation. So the trauma was so intense for the child that unless there was treatment, she could not get over that traumatic situation. So any trauma during the lifetime, either in the childhood or any time in the life, if there like a death in the family, for a child it can be divorce of parents or an abusive parenting or an abusive childhood. These could be the examples of post-traumatic stress disorder.
So the anxiety disorder is said to be one of the common most disorder, mental health disorders.
Yes.
So can you give the prevalence rates of this anxiety disorders?
Anxiety disorders, if you look into the worldwide statistics, among all the mental disorders or the substance abuse disorders, if we put them together, anxiety disorders are seen to be at the top. So if you take the percentage, it is coming up to 3.8%, wherein depression is around 3.7%, followed by alcohol and substance abuse and schizophrenia and eating disorders. So on the top, if you this is recent statistics done in 2016, which reveals that anxiety disorders take the topmost among all the mental health and substance abuse disorders worldwide. So that is the prevalence of anxiety disorders.
The anxiety disorder, it tops first and followed by
depression and substance abuse, alcohol and substance abuse, and also bipolar and schizophrenia. So they fall next to all these disorders, next to anxiety disorders.
There are different treatment techniques, we call it therapeutic techniques.
Yes.
Different types of therapies are there. Yes. One therapy popularly known as cognitive behavioral therapy. Popularly it is called CBT. Can you elaborate this CBT?
Specifically to anxiety disorders, CBT is or cognitive behavior therapy is quite helpful for patients having any anxiety disorders. So CBT is a therapy wherein there is a treatment at the level of the cognitions and also a change in the behavior.
Other techniques also for treating these anxiety disorders. Can you name some techniques?
One of the technique is systematic desensitization, which is very useful in treating phobias. So specifically there is specific phobia. So the person can be this therapy like systematic desensitization is very, very useful in treatment of phobia or panic disorders.
Students, we have discussed so far different types of anxiety disorders. There are generalized anxiety disorder and panic disorder, phobias and obsessive compulsive disorders, and also post-traumatic stress disorders. And we also discussed the symptoms and also therapeutic techniques for treating these disorders. Thank you, madam, for being with us. We have enlightened the students on different aspects of anxiety disorders. Thank you, madam.
Thank you so much.
ఈ కార్యక్రమాలపై మీ అభిప్రాయాల్ని, సూచనల్ని, సలహాల్ని ఆహ్వానిస్తున్నాం. మా చిరునామా ద డైరెక్టర్, ఆడియో విజువల్ ప్రొడక్షన్ అండ్ రీసెర్చ్ సెంటర్, డాక్టర్ బిఆర్ అంబేద్కర్ ఓపెన్ యూనివర్సిటీ, ప్రొఫెసర్ జి రామరెడ్డి మార్క్, రోడ్ నంబర్ 46, జూబ్లీ హిల్స్, హైదరాబాద్ 500033.